Number one, we only ever use the very end of the tip. So the last two are the square shape or something on the tip. The technique areas. Now, to get the technique right, we first need to be clear about the different surfaces on the tip. So we've got this top, which is often referred to as the back. We've got the underside, and then we have the lateral side. If you think of the tip as though it was a square shape or something with four sides, then it might make it easier to imagine where these sides are. So we've got two lateral sides, and then we've got one top or back and one underside. Now this part is really important because understanding how the tip moves is what will help you to understand how to handle it. It's a piezoelectric instrument, so that means that it uses these bilinear oscillations rather than elliptical movements. So think of a bilinear oscillation like a forward and backward stroke in action. Now, there's a couple of really important rules when working with a piezo tip. Number one, we only ever use the very end of the tip, so the last 2 millimeters or so. This is where the majority of movement takes place. So beyond this, and then you're getting close to the nodal point, which is static and therefore it doesn't move and doesn't remove deposit. And the second thing to note is that we only ever use the lateral sides of the instrument. We only let the lateral sides touch the surface that we're debriding. So these are the two areas that are marked out in green here. So the two sides of the tip. The other surfaces aren't working areas. If you want your instrument to perform, you need to use the lateral surfaces and only the last couple of millimeters of the lateral surfaces. And that's the only area that should ever come into contact with the tooth surface. What we don't want is any of the back of the instrument touching the tooth. We don't want any of the underside touching the tooth. And we also don't want any of the upper part of the lateral side touching the tooth either. So like I say, it's only that last couple of millimeters marked here in green that are our working area that are going to come into contact with the tooth. When the non-active sides of the instrument are used, so the front, the back or the tip, they just won't be effective. Well, they will remove calculus, but they won't remove it efficiently, and they'll also cause discomfort to the patient as well. It also goes without saying that we never, ever use the very end of the tip. This would be very painful for our patients. Think about how the tip is moving. So it's moving in a linear pattern, back and forth, back and forth, back and forth, between the back of the tip and the underside. And that means that if you put the back or the underside against the tooth instead of the lateral surface, it would literally be hammering against the tooth surface, which obviously would be uncomfortable for the patients. You can see it here where it would literally hammer against either side of the tooth. Here we go. So you can see the back would hammer and the underside would hammer. Because you're using those lateral sides. If, however, you turn the instrument to 90 degrees so that its lateral surface or the sides that are against the tooth surface, then that'll give a much better result because now the working surface is all that's touching the tooth. So as the instrument moves forwards and backwards, it literally strokes the tooth surface either side of it, very gently debriding it as it goes. Take some time to have a really good look at the tip of your instrument. Remember, lateral working sides are all that should touch the tooth. So have a good look at it. Be sure that you're comfortable with what the side is and what's not the side. When you're ready, place the instrument up against the tooth surface, but only after you've figured out what's the underside, what's the back, what's the lateral side, what's the tip. Just have a really good look at it. Because this instrument is so fine, sometimes I'll use it as an explorer to feel around subgingival for calculus before I even turn the scaler on. And it's quite useful for that. When you're ready, use these really small overlapping strokes, side to side. Just let the instrument lead you. And take care never to roll off of those lateral sides. You'll need to learn to adapt your instrument to the tooth surface, so that means manipulating the instrument around the tooth to make sure that you stay on that lateral working surface. One surefire way of knowing if you're using your instrument incorrectly is to learn to listen to it. It will literally tell you instruments. Any hardly scaling, notice that sound hasn't changed. So the sound remains consistent and doesn't change. Unlike in the next video. Now, if you're hearing like a stridency or a squealing or high-pitched noises, it generally means the instrument isn't adapted properly against the tooth surface. So just like in this video, and I apologise in advance for the awful noises that are coming up. So I start off using the underside. You can hear that squealing and screeching is very different to the last video. And then in a moment, I'm going to switch to the back. And again, yeah, technique, the ears. This is how I switch to the back. And again, yeah, we've got that awful squealing noise, which indicates poor technique. The instrument's not adapted properly to the tooth. Scale with your ears. This is how I always teach Ps on. Listen to your instrument. If you hear stridency, then change position onto the lateral surface of the tip. It'll not only be quieter, but it'll be much more effective, just like I do in this video. So I start off on the wrong surface, so it's really noisy, but notice the change in sound when I switch to the correct surface halfway through. So awful squealy noises. But there we go. As we switch to the lateral surface, much quieter. It might be difficult for your ears to pick up on the different sounds if you're not used to this, but if you take some time to really, I know immediately. So here in this top picture, the angulation's incorrect because the back and the underside surfaces are against the teeth. They'd be moving back and forth, bashing against the tooth. Tip there. So the lateral result. And again here in the top picture, the angulation's incorrect because it's the underside of the tip that's against the tooth is now correct. Just a quick mention about how important it is to change the tips when they become worn. Because you're only using the very last 2 millimeters of the tip, if or when you lose that last 2 millimeters, which will happen just from gradual wear, so meter of tip wear, 50% wear is, and I can use the free this video, look how much less movement there is towards the back of the tip compared to the very end of it, which is moving much more freely. Once you get beyond that nodal point, which is the static point, then the instrument really doesn't work very well at all. So make sure you check your tip length regularly, change them whenever they're getting beyond 2 millimeters of tip wear. Lastly, pressure. So the Ps on PS is a very gentle instrument. It requires a very gentle hand. When you first use it correctly, it might feel as though it's almost not doing anything. That's quite common to hear clinicians say it just doesn't feel like it's doing anything, but that's because it's so gentle. But sometimes if you feel as though the instrument's not doing anything, that encourages you to put more pressure with it. You must, when you are probing the machine, to gently shave through the layers when you are probing. Trust the machine. Trust the machine to gently shave through the layers of calculus. It's a really gentle, truly minimally invasive way to scale, but it does feel strange and different at first, particularly if you've got used to a magnetostrictive ultrasonic. You need to start by retraining your brain and your hands to manipulate the instrument and walk your way around the curvatures of the teeth. Yes, it takes time, but it's really worth it because the lighter the pressure, the better the tactile sensation, the better the instrument will work. You'll preserve more tooth tissue and you'll remove more deposit, or you'll remove deposit more efficiently, should I say. You'll have less repetitive strain and the patient experience is going to be much better as well. Just for your information, I should have videoed myself actually, because I actually scaled that nail blind. So I wasn't looking. I just wanted to show you that that's how tactile this instrument is. So I could feel where the nail polish was, which was very thin nail polish, but I could feel where it was without even looking because the instrument is just so tactile. Change is always difficult. Learning new techniques is difficult too, but it's so very worth it. If you take the time to learn, it will change your working day. You'll be more cost effective, more time efficient, you'll see better results, you'll be working more safely, and you'll definitely have it's very, very difficult to teach technique via a webinar, but I hope you've picked SDA trainers into a list of upcoming courses. I'm sure it's the same in other countries too. We're going to now